everybody. Good to see the group of people are a morning group. Can I get the presentation? Thank you. So, as I was talking to my table, it's really difficult for us to discuss health information technology, considering with all the changes that are happening and all the new announcements that will take place. So I'll do my absolute best to talk about our case study that we've done with return on investment on our EMR software. We've set out to do an EMR software since the mid-90s. We've created a First Medical Suite, which is an all-encompassing practice management EMR solution with an embedded patient portal and telemedicine and the mobile health technology embedded all together. So what we're doing now is we have essentially, what we've done with our case study is we have our dollar figures here on the screen. This is what we present to the business owners and to the doctors and to those different professionals that we present to. What we're still calculating is the actual patient benefit towards a lot of these numbers. It's not so much the financial incentives as much as it is the healthcare life-saving savings that we're making. So what we've noticed within our case, within our return on investment is essentially 10 points. First point is our doctors were able to see more patients within the same number of working hours. What really a lot of problem the doctors were having was documentation. They were being bogged down with documenting because insurers were not paying because of poor documentation, but they were also having to document to protect liability. Within our EMR system, they were able to document quicker, more concisely, more detailed, but they had more face time with the patient. So they were able to talk to the patient more head-on, more eye-to-eye. Now, you may have heard some doctors out there or patients out there with the complaint of, you know, the doctor was typing on the keyboard or they had their back turned, they were trying to figure out the EMR systems. That is a problem with some of the systems out there. But we've kind of wanted our system to be a background kind of component of it. We just wanted to erase the pen with a microphone so that the doctor can speak into the system will record it, or the doctor can actually use a mouse and click through a tablet PC. So the doctor on average was able to see 5 minutes per patient. When you calculate it out through a whole annual basis, the doctor had 12 weeks of patient time. If you do the math, that was a lot more patients that we were able to see. The doctor was able to see an average 6.5 more patients per day. Well, some of our doctors being from the South Florida area, some of our doctors have the opportunity to see more patients that were not able to be covered by health insurance. Some of our doctors utilize these cost savings to provide a service within the community, to essentially help those patients that couldn't afford it, to see the family friends that are in town, to see those patients that really needed the help and the care of that patient. The second cost savings that we saw was a chart movement. Now, this was a savings that essentially varies between different locations. Here we have an estimated chart movement is probably $15 per patient. How do we do that? In South Florida, we may average between anywhere from $20 in different areas to $8 in some areas. This is the labor to find a chart. This is the labor to store a chart. This is the labor to file away labs and other information. So we were able to strategically save these kind of dollar figures and essentially eliminate moving the paper documents and the monetary cost that it would take to move documents back and forth. We've also seen that with number 3, which is we were able to eliminate some of the paper charting costs altogether. Some of our facilities have moved towards a hosted model where we've managed all of their IT on the back end. We've done all the backups, all the security. We've done all the encryption models. And all they really need to have is an internet connection with the firewall on it. And what that does is that saves the doctor from even having to worry about any of the patient charts. If you walk into any doctor's office, the biggest problem that they have, any office manager will talk about, will be that they've lost or misplaced a patient chart, I should say, and that they're trying to find it. We've had offices where the patient has actually walked out of the office with their own medical record, and the office is flipped upside down when the patient walks back in and has the medical record in their hand. Okay, so we were able to eliminate that chart cost and that liability cost also. We were also able to reduce our transcription cost. A little bit about the company. We started off as a medical transcription company back in the mid-90s. So we have the understanding of patient records, paper documentation. So we were able to reduce the transcription cost. We were even able to use transcription as an equilibrium or a medium to get the note into the system. As you know, we do have a lot more senior doctors out there who are a little bit technology wary. So what we've done is we've replaced the microphone, or we've replaced the pen with a microphone or a dictation device that will record into the EMR system. We have a transcriptionist that will transcribe it overseas or even locally and upload it right back into the patient chart. So that data becomes searchable data and queryable data. At the very end, the doctors will be able to query the data that they needed inside the system, but also within the data elements fields within the chart. Essentially, the biggest problem that doctors were having, or the offices were having, was that they were chasing the paper. Lab reports would come in through the fax machine. So specialist reports were coming in through the fax machine. Someone needed to manage the fax machine. And if you ran out of paper or toner, it was a complete nightmare because things were not being stored in the printer or the fax machine. So they would have to call the doctor's office, get them to get a refax back into the system. So we were actually able to stop having the office chase the paper. We digitized all of their faxing capabilities, all of their scanning capabilities. We also worked with the vendors to get a third-party imaging systems. So now that we integrate with Fujitsu and other big vendors, the doctor's office will connect to those systems and essentially pull the imaging systems or imaging reports right back into the EMR system. We are also working with our local university, Florida Atlantic University, in creating a virtual imaging component where the doctor can connect to a remote system and view the actual X-ray on their servers. So that you have all the security features, but you don't have the bandwidth utilization to pull down an X-ray machine or an X-ray image. Here's another thing. We were able to improve E&M coding. What happened is doctors were significantly cutting themselves short on E&M code. This is called the evaluation of management. This is the level of the detailedness of the visit. This could be hundreds or even, it could be hundreds of dollars a day that the doctor can be cutting themselves short of. And this is because they wanted to play under the radar and they wanted to make sure that they were compliant. They wanted to avoid any audit logs, so they were undercoding themselves. But what we really noticed here was that the doctor's time spent with the patient was being documented correctly. What we noticed here is our secondary concern was when we talked to patients, as soon as they left the doctor, they left with a smile on their face because the doctor was able to spend more time talking to the patient, explaining the detailedness, explaining the disease, the illnesses, what possible treatment plans there were. We were noticing that the doctor benefited from having that one-on-one with the patient. All of the doctors that our study has focused on was they wanted to spend more time with the patient and less time documenting everything that was needed because they felt that they needed to document to cover their liability purposes. We've also had automated charge capture. And essentially here we have our final numbers as to where we were calculating everything. Essentially, per year, a doctor was saving around $200,000 with all of these cost benefits. And this is a average size practice in South Florida. I believe it's 3 doctors where they were seeing an average of 30 to 40 patients a day per doctor. They are located next to Memorial Hospital, and they were able to see their patient spread was roughly I think around 35 to 40% Medicaid, They were seeing 30 to 40% Medicare, and the rest of them were private insurance. And then you had about a 10% of patients that were a free-based kind of visit. So on average, we were able to see the cost, and these are the financial numbers of the benefits of each of these, of our study, of what we were able to produce to each of our doctors on average. One of the unique things is after the very end, as we're still calculating our numbers, we're doing a patient perspective on this. And the patient perspective that we're doing is how many diseases were more under controlled. Right now, we know that we had 20% of our diabetic patients were able to control their diet plans, were able to better utilize their medications, were able to control their diabetes, because we have a patient portal that gives them the information that allows them to learn from that system, but also the doctor has direct communication with the patient. We have it where the patient practice can talk to the patient. Some of our doctors have a nurse on staff that will call the patients to see if they have any questions, to see if they have any additional information. Because of all those time-saving features above, the nurses was more freed to follow up with the patients and see how health is coming along. What we've also noticed with some of our patients is obesity and hypertension. We were able to control that. When we were talking to the associated consulting cardiologist, they noticed a more intelligent approach of being able to control the diabetes, cholesterol, hypertension, those chronic heart diseases that can happen for patients, and chronic illnesses of the patient's health. And so what we've benefited from this study is we're still performing this, and I could issue this out within the next 2 months or so, that the patient's perspective, every patient we asked always had a smile and said that they were happy that the doctor moved to an EMR system, only because the patient had access to their medical records. They were able to bring in their medical records, their primary care documents to their specialist, but also that they were able to learn about their health. If you put their health back in their hands and have the patient more control of their knowledge and know where they need to do and what they need to perform for their health, they do take control of that. Our best evaluation was that, comparing it to the banking industry, when you go to Starbucks to get a coffee, you'll know that charge is pending. But can any one of us in this room know what our lab values were for the last lab work that we've done? Very few of us know what our CBC count is right now, or what it was for the last time we visited. It's not readily accessible, but that all needs to change. So I would like to thank you for the time. I know I went a little bit under, and if anybody has any questions, please feel free to catch me in the back.